I recommend Wendy Foster for her mamalates brand itself because it's so innovative. She's taking the needs of moms, things that are really common to everyone, diastasis, that repair work, the pelvic floor, everything that moms really complain about postpartum, she can help, she can solve, and she's come up with these really great techniques that are amazing, have great results, and she's nurturing, she's been there, she's talking to moms about their babies. So I recommend to all of my clients, if they're having any sort of postpartum issue, if they want to regain some core strength, if they want to feel strong again, to do whatever they want to do, whether it's running or cycling or swimming or Pilates, just to rebuild that core a little bit, to recover from birth. She has these essential things, essential exercises that you can do that just rebuild and make you feel strong again. And you know, every mom who goes to her says, oh, that made such a difference. And now, oh, now I can go do triathlons again. Or now I can pick up my baby and I don't have pain in my back and I don't have pain in my belly. So I've really seen tremendous results. And I recommend that both my doulas get trained in her technique so they know how to help moms bind after birth and really recover. And I recommend to the moms for sure to try out a class, to do a series, see if they can make a difference so they can feel strong again.
But I am excited to be here. My name is Wendy Foster and my business is mamalates. It's a restorative birth recovery method that I started over 10 years ago. And I'm here in Portland, Oregon. And I have videos online and products that I sell. So even if you don't live here in Portland, you can benefit from some of my products. And I want to start by getting everybody just to stand up for a second. Can everybody stand up? Because sitting is the new smoking. Did you guys know that? Sitting is the new smoking. It is so bad for you to sit. It's so bad for the kids to sit all day. So what you can do here is you can reach your arms up and just take a big inhale through your nose, and then a big exhale through your mouth. And again, you can inhale, reach your arms up. And you can exhale through your mouth. One more time, inhale, reach your arms up. And exhale. Then you go ahead and sit down. Doesn't that feel good? Just to kind of do that for like a second feels so good. Thank you for all being troopers and standing up. I know some of you didn't want to stand up, but you did. Thank you. So I have about a 20-minute, probably even less now, little workshop here that I'm going to try and squeeze in. And I know most of you are here because you want to know the top 10 sort of essential things you can do postpartum for birth recovery to help you get back into shape and to kind of assess what's going on. And I'm here to tell you there are some great things you can do, and you should start those things immediately postpartum. So you shouldn't wait 6 weeks or 6 months. There's some very gentle things you can do immediately the same day your baby's born. Okay, so who here has had a hospital birth or is planning a hospital birth? Raise your arm. All right, who here is planning a birth center birth or had a birth center birth? Raise your arm. How about home birth? Raise your arm. Okay, so mostly hospital births, some home births, and some birth center births. That's great. I don't know, did I miss anything? Or is there any other way to have I mean, I guess those are sort of the options. Okay, so one thing I like to tell people, and I'm kind of gear this towards the hospital birth, but it can be if you're with the midwife at home or if you're at a birth center. The first thing you want to do postpartum is you want to get a prescription for physical therapy. And if some of you have come up to me and visited me at my booth, you might have heard me say that earlier, you should ask your medical provider to write you a prescription for PT. You might use it, you might not use it, but then that way you have it at the ready, so then you don't have to wait 8 weeks to try and get a prescription and then wait another 10 weeks to try and get into your physical therapist. So that's the first thing you should do. The second thing you should do is to make sure that you leave the birth center or the hospital with an abdominal binder, okay? An abdominal binder looks something like this, and you wrap it around. Who left the hospital with an abdominal binder? 4 people. 4 people left the hospital with an abdominal binder. So I can tell you they probably will not offer it to you, but if you ask them, especially the nurses, they will go in the back room in the closet somewhere. Magically, they will find a binder for you, and they will bring it to you, and your insurance will pay for it for you. So you should ask them for that for sure, even if you're not sure if you need it or want it, okay? Pass it on to a friend, and tell your friends that too, because the more people that start asking for those, the more they will start distributing them, okay? Who here knows if their abdominals are separated? Anyone? Anyone? 5 people. 5 people know if whose abdominals were checked by their healthcare provider. Did I already ask that? No. Anybody have their abdominals checked by their doctor or their midwife postpartum? 4 people, 5 people. Okay, so the reason you want to have your abdominals checked postpartum is because 2 out of 3 women actually separate. There's 6-pack muscles. There's a band of connective tissue that goes all the way up through the 6-pack muscles, and that band is designed to stretch. It's right where you get that brown line during your pregnancy. Underneath that band is designed to stretch, but what's happening is a lot of people now, that band is actually splitting, and that causes a gap in between the right and the left side of your 6-pack muscles. So if you are going into this time with a newborn with a gap in between your abdominal muscles, and you're bending forward all day long from lifting up your baby or feeding your baby or changing your baby or maybe lifting up an older child, that gap can get wider and that separation can become worse. So you want to have that information going into that time with your new baby so you know what you should do and what you shouldn't do. You can heal that gap, but there's certain moves you don't want to do, like rounding forward, which is what you're doing all day long, or sitting at a computer, rounded forward all day long. You want to be nice and tall and hinge instead of rounding forward. You want to hinge instead of rounding forward, okay? So you want to have that information going into that postpartum time, all right? So checking for the abdominal separation is huge. Wearing a binder can help prevent that gap, and it can also actually close up the gap, and the connective tissue can actually weave back together, okay? If you're doing restorative exercises and if you have the information and you're using your proper biomechanics by hinging instead of rounding forward, then hopefully that gap will heal, okay? So those are the first few ones. I got to review my notes here because I know that I wrote a bunch down. Oh, the other thing you need to do, pelvic floor exercises. If you had a C-section, if you had a vaginal birth, if you had an episiotomy or not, pelvic floor exercises should be done the day you have that baby, okay? All the cells and everything is still alive. You can start doing some gentle Kegel type work. I can talk more about Kegels if you have questions about that up at my booth, but more sort of lifting up on your pelvic floor and starting to engage your pelvic floor, and that will help your pelvic floor heal later on as well. So you can start that work the day you have your baby, okay? So you don't have to wait 6 weeks to do that. The other thing you want to do, along with finding out if your abdominals are separated, is you want to check your alignment. Most people during their pregnancy, they get this sort of arched back and their shoulders kind of round forward, and postpartum they still have this arched back and their shoulders are still kind of rounded forward. So you want to try and adjust your alignment, and one of the best ways to do that is a foam roller. Who has a foam roller at their house? About 20 people. That's pretty awesome. Who wants to get up on this foam roller and check it out? Who's got rounded shoulders? Who's kind of schlumpy? Nobody? Nobody's schlumpy? Nobody in here schlumpy? Come on. How about you standing there against the wall? No? Nobody? Okay. Well, I can't get on it because I've got the mic on my back. You want to get on it? You can get on it. Come on up. This little girl, this is perfect. If we learned this stuff when we were, how old are you?
9.
You're 9? What's your name?
Cadence.
Cadence? Okay, so Cadence 9. So if we learned about our pelvic floor and our alignment when we were 9, think of how much information we would have going into our pregnancies and our birth. That'd be pretty sweet. So Cadence going to learn about her alignment. She's going to get down on the roller here. Have you ever been on one of these? Mm-hmm. Oh, you have? Okay. Your head's going to be up here, and your feet are going to be on the floor, and your whole head's on here. So slide down a little bit, bend your knees, and feet on the floor. Yeah. So just kind of balance there. It's a little harder for her because she's kind of small. I know you might not all be able to see her. But just being on the roller is going to counteract all that schlumpiness that you've got going on from being on a computer, lifting kids, emptying the dishwasher, welding, whatever it is you're doing. So she's going to lay on the roller, and she's going to bring her arms out with her palms up. And she's just going to do that same breath that we did. She's going to start with her arms down here. And she's going to inhale in through her nose. And she's going to exhale through her mouth, and her arms are going to come down. And she's going to keep doing that. And she's going to get her rib cage to move and the muscles in between her ribs to stretch. If you have asthma, those muscles can be really tight. Okay, and if you're having back problems, it could be because your ribs are in the wrong place postpartum. Most of us are really open through the ribs to make space for that baby, so your job postpartum is to close those ribs up, and the roller can be really good for that. I'm going to have her do one more thing, because you can use the roller to align, and you can also use it for core work. So press your arms down into the floor, and see if you can bring one knee up to a tabletop position without rolling off. That's pretty good. Can you bring two up? Pretty good, huh? So it's good core work. Can you feel that in your belly?
Yes.
She said she could feel that in her belly. That's pretty sweet. All right, you want to roll on off of there? Didn't that feel good? Stand up nice and tall now and show everybody how realigned you are. Turn and face that way. See how aligned she is now? That's great. Yay! Thank you. All right, so there's the foam roller. There's the alignment. And the next thing that we're going to talk about is stabilization. So your job now, too, is to stabilize your pelvis. If you've got the hormone relaxant still flowing through your body, maybe you're nursing, maybe it's just a couple of weeks postpartum, maybe you had some SI joint issues, or so you needed to go to the chiropractor a lot during your pregnancy. It can be because you've actually got too much relaxant, especially if you have twins, you're going to get a big dose of that. So your job now is to kind of recontain and stabilize postpartum. So the way to do that, again, is with restorative exercises. You can bind or splint if you need a little extra support. There's also some SI joint belts that you can get if you need that. But the most important thing is to not overdo it and overstretch. You're excited to go back to yoga. I get that. Yoga, it feels so good to stretch, but you can still overdo it. Just like during your pregnancy, you want to stay in the 70% zone while you're stretching and exercising so you don't overdo it and cause injuries. So thinking about moving from a stabilized place postpartum so your shoulders aren't creeping up towards your ears and your hips aren't wiggling around. Okay, so stabilization. I'm going to have someone come up here in a second, so I want you all to think about if you want to be that person. Just start thinking about that. Do I want to be that person that comes up? Because I'm going to need one person to come up here. Okay, breathing. One of the most important things, I know I probably said that already, but one of the most important things you can do postpartum and just for the rest of your life is to exhale on exertion. And I know that might be counterintuitive for some people, but you want to exhale as you pick up that baby. You want to exhale as you pick up that car seat, okay? You don't want to hold your breath and you don't want to inhale. You want to exhale, start engaging those abdominals, then do the work, then pick up the car seat, then pick up the baby as those abdominals are engaged. So think about that too the next time you're picking up some kids, all right? The next thing I'm going to talk about is reconnecting to your core, and you want to do that safely. So you don't want to start doing crisscrosses, you don't want to start doing a bunch of crunches. You want to safely connect to your core and stay in a lengthened position as you engage those abdominals. And again, the foam roller can be great for that because you'll be getting the feedback of your alignment on the roller while you're doing your core work. So you'll know if you're crunching or shortening or bulging those abdominals out, which you don't want to do when you're doing your core work. So doing restorative core work before you go really deep and start doing some crazy TRX or I don't know, whatever people are doing, CrossFit, things like that. Okay, the next thing you want to do is you want to stretch. You want to take the time to stretch out, open up your shoulders, and again, the foam roller can do that. You might have a couple of stretches that you like to do. I do have a 8-minute stretching segment on my YouTube site, 8 minutes. You can just get on and do it a couple of times, and then maybe even make it shorter. Just pick a few of the stretches that you really like and do a 4-minute stretching segment. Yeah, 4-minute stretching time for just even a couple times a week is going to make a huge difference as you're caring for the new baby and possibly toddlers as well. And then when you go into your exercises, you want them to be safe exercises. You're not looking for the big Shazam workout. You're not looking for the Pilates hundreds if you've done Pilates before, or the really, intense, crazy exercises that look really great and big. It's almost harder to go slower and to go deeper, and then you'll be working the deeper muscles and not such superficial muscles, which that's going to be your friend to do that and use more of the smaller muscles. And then the last thing that you want to do is you want to make all of this a priority. You want to make sure that you have some time carved out, okay? Even if, again, it's just a few minutes. a few times a week. Don't think that you need to have a whole hour to sit down and do these exercises and then do the stretches and then do the breathing and then do all this stuff and you've got all these other things to do. Even if you just have 10 minutes a few times a week, it's going to be better than nothing, and it's almost better than doing it once a week for an hour because your muscle does have memory. And so if you can just start to incorporate that breath into everything that you do, or maybe start to engage those abdominals as you're sitting at the breakfast table, although I don't know, I didn't sit for like 3 years and eat when my kids were little. So when you're standing at the counter, you know, you can do it, all that stuff. So making it a priority so that you don't end up unraveling 8 or 9, you know, months down the road, because that's sometimes what happens. So who thought in their mind, I want to be that person to come up there? Anybody? 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 Yay, she's gonna do it. Nice. Got somebody. I know it's hard to come up. I'm not going to make you juggle or anything like that. Okay. So, what's your name?
Natalia.
Natalia? Okay, thanks. How far along are you?
My 8 months.
So she's 8 months pregnant. And, okay, and where are you having your baby?
Where?
Where?
OHSU. I'm having water birth, hopefully.
Yay! Water birth up at OHSU. So, what have you learned so far from this little talk here? What are you going to do up at OHSU with your water birth?
At the water birth?
Well, before you leave the hospital.
Before I leave the hospital, I'll get a prescription for physical therapy.
Yes.
I'll get a binder, abdominal binder too. And something else. I wrote everything down.
You did?
So I have it.
Yes. So the only other thing that's awesome, she's gonna make sure her doctor checks her for abdominal separation. Okay, that's the other thing you're gonna do.
Written down.
Okay, it's written down.
Yeah.
Okay, great. Thank you very much. All right, thanks. All right, I need one more person. I didn't say this earlier, who's not pregnant. Are you pregnant? Okay. I need an adult though who's not pregnant. Yay! She's gonna come on up here. This is gonna be great. Anything works. You can even take an old pair of like yoga pants and wrap them around, or a scarf. Most cultures do some type of binding. But if your abdominals are separated, you're gonna need something that's a little more therapeutic to help the connective tissue come back together. So I'm gonna show you this one. So let's see. It goes this way here. Yeah. So this is the binder that we have here. Okay, and you just wrap it around. You wrap it around once, and then the ones on the that crisscross kind of help to lift it up. Now, also in the back, do you mind turning it around? It's a little bit higher in the back. So for people that have a really long torso, you can actually turn it around and have it, the back be in the front. And what this is doing is this is actually creating the manual support. It's acting as like your own inner corset, because what you have where your abdominals are separated right behind that gap, those are your inner organs, and they're falling out every time you round forward and flex and pick up the baby. So you want to kind of pull everything in. Does that feel too tight? Can you breathe?
It feels good. It feels good.
Okay. So when you have a binder on, you want to be able to take a big breath into your ribs and expand the ribs. You don't want to feel compressed so you can't breathe. And you're looking also for something, do you mind turning to the side? That has some type of a stay on the side here, because that's going to help you stay lifted up. And there's some great wraps out there, and that's exactly what they are. They're just like a little wrap. But if you want something that's going to help you stay lifted, so when you sit down, you're not going to compress, or when you're driving in the car, or when you're sitting at your desk, you want something that has some type of a stay that's going to help you stay lifted. And the other thing these binders can do, besides help your back and help your abdominals come back together, is they can help with your pelvic floor. Because if you have abdominal separation, all those organs are resting on your pelvic floor, and that can cause incontinence and all kinds of issues. So if you can pull everything up off of your pelvic floor, then you'll hopefully be dealing with that, taking care of that problem too. Can I take it off? Yeah. Thank you. Yeah. All right, so thank you. I guess now's the time where I'm going to ask if anybody has questions. I know that was just like, so she wants to know how soon after birth she can start wearing the binder. And I'm so glad you asked that, because something like this, which is like a binder light, basically, you could wear this the day after you deliver. Okay, you want to have your organs and your uterus and everything kind of come back into place. But the OBGYN who endorses my program, she has her people wear these, her clients and patients wear these a day after they deliver. Sometimes you can maybe wait a couple of days. You'd wear something like this for 2 weeks. And then again, if you are extremely separated, or more than 2.5 fingers separated up your belly, you would wear something a little more therapeutic, and you could wear that for 2 months. And people ask, well, it's been a year, can I still wear it? Yes, you can still get those abdominals to come back a year, 2 years, even 5 years later. It's a little bit harder if you've been doing crunches and kind of shortening everywhere and building the six-pack muscles up, but you can get those abs to come back. So she wants to know if you can, if you have to wait longer after a C-section to put the binder on, or if it's the same. And no, in fact, it's the same, and you definitely want to bind if you have a C-section. And that's what I also like about this one, is you can actually fit an ice pack inside of it if you want ice on your scar to help with the inflammation. And something like this is not going to rub on your scar, so even if it's not completely closed up, you can do that, yeah. Where do you get one of those? Well, I sell them on my website at mamalates.com. That's why I sell all this stuff, because I spent 1.5 years looking for the binder that I thought was the most affordable binder, that was going to be the most effective binder, that you could actually take on and off easily if you're, nursing and going to the bathroom and things like that. So yeah, you can get them on the website. So she wants to know if there's anything you can do on the foam roller while you're pregnant. Yes, the foam roller can be used for almost anything. You can't eat it, but your partner can use it, your kids can use it. You can use it against the wall until you feel comfortable getting down on a foam roller if you had a C-section, or if you're extremely pregnant. I use the foam roller up until pretty much the day I delivered with both my kids. So you can get on and off of it. It's a little bit challenging to do that, but you can certainly do that. Yep, the same things, and I do have some foam roller videos on my website too, and on my YouTube site to show you, to stretch out the hamstrings and things like that too postpartum. Thank you all so much, I really appreciate it. Thanks.